explain to me where the secret sauce is in this modularity?
Right. So as Gary and I were discussing, this is the base parent balloon, right? Catheter, right? And that's going to be common. Everybody's going to understand what that is. It's not really any different. But the idea is you can take these smaller adapters, right? And there's a unique way to couple the two things together so that it's one way, it's secure, it's reliable, it's robust, and it's not going to come apart. And now you've added the feature. In this case, it's a very simple feature. You've just added a secondary lumen so that now the doctor, the physician, can use two wires at the same time. One is through this rapid exchange, kind of using rapid exchange techniques, but you still maintain the central lumen. And and I think this is an easy, simple example, but you can, once you start thinking differently about how to incorporate this type of modular approach, it really brings you to you start adding more complicated features, more sophisticated features, really taking the design approach in new and different ways to add a lot of value. And we can get into the modular economies, but I think the pathway for bringing it from this kind of concept to actually a sales opportunity, it's dramatically more efficient. It's cheaper, faster.
So Gary, when you see this device, what immediately comes to mind as a clinician? The customization of things, you being able to expand your skills. What comes to mind when you see this?
Well, I see it as multiple applications for that adapter. So now I can take a balloon catheter that has one usage, inflate a balloon. Now I can add an adapter to it, which could be multiple, and I could add a imaging section to it. I could use a scoring section to it. I could use a blood clot removal section to it. Could use a catheter tip section to it, which would decrease the number of times I have to take a device in and out of the body. And that we have to do with radiation. So there's always that radiation exposure during that time. There's time. I mean, I've got to work with an assistant, and we've got to back the early device out when it's a standalone just balloon. I've got to back that out and then put the next device in. And then I've got to go back to my balloon and then put the next device in. So there's a lot of steps to doing these percutaneous procedures that these adapters can cut down the number of steps and make it from a single use device to a multiple use device. Multiple different aspects of that can be done at the same time. For instance, oftentimes there's calcification in these blood vessels that is very hard to open or dilate. And the regular balloon just can't get that one or two little areas. And we've got to back that balloon out, take a high pressure scoring balloon in, then we bring the other balloon back. Where if we just add a high pressure short balloon to the tip of this, I can do it all. I can go in, I do my dilation, I figure out where it's not going to work very well, and I just bring that catheter with that little high pressure segment back to that area, and now I inflate there. So I can do multiple things with one entry into the body. And for me, that's time efficient. It's pleasing because, I'm being more successful. It's simpler. So I think there's a lot of good aspects here.
And so the great additions by Gary on the clinical side. But now when we're talking about cost, we're talking about, instead of having 17 of these sitting on the floor somewhere, right? Now my rapid exchange is really at the distal tip where I'm applying the therapy to the patient, where the rest of it really is just the rails that's being delivered on.
That's right, yeah. And then you can use the same backbone, the same base module for all of those adapters, for anything, right? So now you're adapting it. It's like kind of to Gary's point. So instead of, you're basically adapting your equipment for what's happening during the procedure. So instead of exchanging a guide wire, I'm just going to downsize my catheter, so I'm using a smaller guide wire. I mean, those are the types of embodiments we're thinking of.
And it feels like Gary is a clinician and an artist, right, and a technician. It helps you stay in the flow better too, right? Otherwise, you're waiting for an exchange, you're waiting for another device, you're waiting for a team member to hand you something. It almost feels like this is a lot more staying in the flow of a procedure.
Yeah, I'm not watching paint dry during those procedures. When you're not doing anything, as a surgeon or interventionalist, you're just, you're not used to standing there with your hands, not doing anything, just waiting for things. You really want to get things in a flow to that procedure. That keeps your assistant in the flow as well. The room keeps flowing. I mean, you're much more efficient, like you pointed out, time efficient. So it's a cost-effective procedure or more cost-effective. And we've got to get to that.